Hello friends, today we talk about the pre-anesthetic orders. First we talk about the nil per oral. For adult and children, both having different classifications. For adult, 6 hour NPO is required for the liquid and the semi-solid food, and 2 hours NPO for the clear fluid. While in the pediatric group, 6 hour NPO is required for the semi-solid and the formula feeds, 4 hours for the breast milk and 2 hours for the clear fluid. It is suggestive. Now we talk about the pre-medications. In pre-medications, we give the benzodiazepines, and we prefer those benzodiazepines which having the good anxiolytic property and a less sedation effect. So the examples of these benzodiazepines are the midazolam, diazepam, and lorazepam. Here we have to note that the midazolam has the fastest onset and the shortest duration of the action, while the diazepam has the longest duration of action. Now we talk about the before prescribing the anxiolytic patient to the anxiolytic drug, we have to screen for any contraindication or risk of anxiolytic properties. Okay, so the examples of patients which having the screened is extremes of the ages and any head injury and decrease the consciousness in a patient if we give the anxiolytic drugs. Okay friends, now we talk about the role of anticholinergic drugs in pre-medications of anesthesia. First we talk about the property, the anti-slog property, vagolytic property, and sedation and amnesia property. Here, anti-slog property causing the decrease in the secretion, vagolytic causes increase in the heart rate. Now, examples are atropine, glycopyrrolate, and scopolamine. Here, we have to note that the glycopyrrolate is the quaternary amine which will not crosses the blood-brain barrier. So, the amnesia and sedation effect are not occur in the glycopyrrolate. Here, we see the vagolytic property is maximum in atropine, anti-slog property is maximum in glycopyrrolate, and sedation amnesia maximum in scopolamine. Okay friends, now we talk about the order regarding the previous medications. If any patient having the hypertension and continue taking the hypertension drug, then it should be continue for the till the day of the surgery. And for the hypoglycemic drugs, then it should be stop the last dose of hypoglycemic for the minor surgery, and for the major surgery stop the last dose of the hypoglycemic agent and put on the insulin. Okay friends, now antipsychotic drugs. Antipsychotic drugs are also continued till the day of the surgery except two conditions. Tricyclic antidepressant which should be stopped 3 weeks prior to the surgery, and lithium stopped 24 hours to 48 hours prior to the surgery. Now we talk about the anticoagulant. Okay friends, anticoagulant, the very famous drug is aspirin. So aspirin should be continued till the day of the surgery. For the glycopyrrolate, stop 5 to 7 days prior to the surgery. Ticlopidine stopped 14 days prior to the surgery. Warfarin stopped 3 to 4 days before surgery, and low molecular weight heparin stopped 12 hours prior to the surgery. Now we talk about the steroid. Steroid should be continued with pre-operative supplementations. Okay friends, what? Because if we in patient on steroid for greater than 3 days, the hypothalamic pituitary axis will be inhibited and steroid production will be inhibited. So that is the reason why we continue the steroid. And 3 conditions where we need to stop the steroid is the diabetes, active infections, and immunocompromised patients. Okay friends, now we talk about the herbal medications. Herbal medications should also be stopped 4 to 6 weeks prior to the surgery. Now, hormone replacement therapy. Any patient having the hormone replacement therapy, it should also be stopped 4 to 8 weeks prior to the surgery. Now we talk about the antibiotics. It is recommended to give IV antibiotics 1 hour prior to the surgical incision. But if prior to the surgical incision is not given in the option, then we go for the prior to the induction of the anesthesia. If you like my content, please like, subscribe, and share with your friends. And please comment below on what topics you want the lectures. Thank you.